Hello, this is your daily COVID-19 update for Friday, October 22, 2021. We begin today's program with Minister of Health Dr. Frank Anthony updating us on the current stock of COVID-19 vaccines in the country.
We have an adequate amount of COVID-19 vaccines, right? We have been using AstraZeneca, Sinopharm, Sputnik V, Pfizer, and J&J. So these are the vaccines that we currently have. With AstraZeneca, we have given out most of the first doses, and we have about 55,000 or so persons who need to get their second dose, so we have those second doses available. In terms of Sinopharm, we have adequate vaccines for both first and second doses. And Sputnik V, we have first and second dose currently available. J&J, as you know, it's one dose, so we have those available as well. And with Pfizer, we are using that for children between the ages of 12 to 18, and also for pregnant women and breastfeeding women.
Dr. Anthony also updated the nation on the current vaccination numbers.
We have completed first dose vaccine. We have about 376,436 persons who would have received a first dose vaccine. That's approximately 73.4% of our adult population. And for second dose, we've completed 236,238 persons. That's equivalent to 46.1% of the adult population receiving a second dose vaccine.
A regional report of persons who took the first dose of the vaccines showed that regions 2, 8, and 10 need to improve in their vaccination numbers as Guyana strives to achieve herd immunity.
Region 1, we are currently at 79.5% of the population. Region 2, we are at 59.6% of the population. Region 3 at 70.1%. Region 4 at 82.3%, Region 5 at 72.4%, Region 6 at 73.8%, Region 7 at 72.4%, Region 8 at 45.4%, Region 9 at 73.6%, and Region 10 at 33.1%. These are persons who have received their first dose of a COVID-19 vaccine. So as you can see in Region 10, we are really lagging behind because they have only completed about 33.1% of the region's population. If we hope to get to herd immunity in that region, then we have to increase this to at least 90%. Again, Region 8 is also lagging behind. They're at 45.4%. And again, if we want to be at herd immunity, it's about 90%. Region 2 is also lagging behind, and they're 59.6%. And again, if we're looking at getting herd immunity against Delta, it's about 90% of the population. So we have a far way to go in terms of vaccinating, especially in these three regions.
In Region 4, the most populated region in Guyana, 82% of the population has had a first dose of the vaccine. But Dr. Anthony said this still needs to increase.
As you would see, the higher the immunization rates go up, you will see a fall off in terms of the hospitalization and the deaths. And as we increase these numbers of persons being vaccinated in Region 4, you are going to see the cases come down.
The ministry is also expecting more vaccines to arrive in the country very soon.
We have in the pipeline, we have a number of other vaccines that are coming in. So this week we'll receive some more Sputnik second dose. We have in the coming weeks, we have some more AstraZeneca that is coming in, and we have Pfizer vaccine that is coming in as well.
With regards to concerns raised about the WHO's approval of the Sputnik V vaccine and how this affects travel, Dr. Anthony had this to say.
From the information that we have received, and we have been in a meeting, an international meeting, we were told that the Sputnik V vaccine is scheduled for WHO approval sometime in November, the latest by the first week in December. So if they hold to that schedule, then the WHO should approve the vaccine. Once it's a WHO approved vaccine, then you wouldn't have any problems with travel. Nevertheless, countries that are requiring vaccines right now, doesn't matter which vaccine you get, you have to let them know up front, and they would allow you to come into the country. However, you would have to be in quarantine for some period of time. And once that time elapses, it's okay, you can then start moving around. And that quarantine usually happens at home. So wherever you're going, you quarantine at home, and that's quite permissible.
Is there any system in place for those persons who to possibly be revaccinated if they need to travel for emergency purposes or otherwise?
At this point in time, the government does not have a revaccination policy. We're not encouraging it at this point in time because right now I think a lot of people are concerned about travel to the United States. But the United States haven't set a date by when they would be accepting vaccines, or they haven't said anything as yet. So there's no information. So we don't have right now a policy of revaccination because at this point in time, if we are going to revaccinate people, it means that some people would get more vaccine than is necessary, while we still have an unvaccinated population who would be at risk of getting COVID. So we first have to reduce that pool of unvaccinated before we start thinking about giving people additional doses of vaccines.
You have been watching the daily COVID-19 update for today, Friday, October 22, 2021. I'm Natasha Smith-Thomas. Thank you for watching.